up about doing a dental implant, patients immediately want to know what are their alternatives for replacing a tooth. So let's talk about that. First thing that comes to mind.
First thing that comes to mind, if there are teeth on either side, is doing like a dental bridge. It's still something that at least can be cemented in, so it's not a removable thing for the patient, which is sometimes their desire. And then other times, like when that's not an option, if there aren't teeth on either side of our missing space, then we're looking at removable things like partials.
We'll talk about the time. There are some benefits of a bridge in terms of time, initially.
Mm-hmm.
Like the
It can be
patient.
immediate.
Yeah, you get some immediate gratification.
Mm-hmm. Absolutely.
But
it's going to put a lot of stress on the teeth that it's hanging on to, and if you have two perfectly healthy teeth on either side, do you really want to put all that trauma on those healthy teeth just to replace one tooth?
Like they tell them, it's like a one for all and all for one type of thing. It's like if one of those abutment teeth, the teeth we're using as a bridge goes bad, or you get a cavity around the margin of it, that whole bridge and all the money you put into that bridge has failed. So it's like it puts a lot on the patient. It's like you gotta really be thorough cleaning around this thing because
and the time, like a bridge may last on average maybe 10 years, And so if someone's 40 years old and they get a bridge, well, I feel old now because I'm seeing all these cases where they come back and they had a bridge that went from here to here. Well, now this tooth goes bad, so now the bridge has to go from here to here. And then this tooth goes bad, but we can't make a longer bridge. So that's what I feel like we start to see patients who are in these situations where we can't do that
Right.
anymore. And then it's back to...
Well, and it's crazy because once you've replaced the bridge that one time, you've already lost the difference in cost between doing a dental implant the first time versus doing that bridge the first time. An implant, in theory, is close to forever. Maybe the crown has to be replaced, but you're not risking the expense of what's going to happen to the neighboring teeth.
And like that partial, things that come in and out of your mouth. I mean, now and then we'll see a patient who's happy, but what is your experience with patients with a partial in their mouth? Like real
They're
life?
usually not in their mouth, they're usually in their pocket.
paperweight.
They forget to bring it with because they don't wear it all the time. They try to wear it when they go out to eat somewhere, but then it's kind of a struggle when they're eating in public and, it just moves around a lot and sore spots. And then again, when we're talking about the stress put on the teeth around the space, a partial's got to hook on to those teeth as well. And, it can cause some damage in the long run to those teeth also.
Yeah, a lot of times that partial turns into just the transition piece to a full denture. We do it all the time where we're adding teeth to the partial because, we basically just started transitioning them to being edentulous.
I think that's one of the most exciting parts about doing implants is seeing someone not go backwards in any way when they lose a tooth.
Right.
As opposed to when you see people over the years lose one tooth and then another tooth and another tooth and another tooth on the other side. It's this, you see the regression or the aging of the person. Whereas when we do a dental implant, it's almost just we're right back to where we were, and we're keeping that person from going downhill. So, but no, I think that's good. It's a good discussion of the alternatives.